I'd like to finish up this chapter by talking about some problematic issues related to drug use, and talk a little bit about overdose and individual differences in drug addiction, and then also treatment, different types of treatment options. One thing, remember the therapeutic ratio that we talked about earlier in the chapter, and that's the ratio between the dose that's required to get the therapeutic effects of a drug versus the dose that's required to get the toxic effect of a drug. Well, sometimes individuals can develop a tolerance to the therapeutic effects, and so they might increase their dosage to get more of the therapeutic effects, and then unintentionally run into the toxic effects. And so and that can cause respiratory arrest in the example that we saw. So that's one of the reasons for overdose. A little bit about heritability. So this graph is showing heritability rates to specific drugs, and you can see they are in the 0.4 to 0.6 range, and so there seem to be some individual differences in likelihood of becoming addicted. And there also are some differences in becoming addicted to specific substances. So you're less likely to become addicted to a hallucinogen if you have a family member who's addicted, but if you have a family member that's addicted to cocaine or opiates or caffeine or alcohol, you're more likely to be an addict yourself. So we know that genetics play a role. What is inherited? And we think that individuals probably inherit variations in their neurotransmitter systems that make them uniquely susceptible. We've identified some differences in individuals who are alcoholics, and what they've done with these studies is looked at the young children who've never had a drink of parents who are alcoholics, and they found some neurological differences in those children prior to exposure to alcohol that suggest that they may have kind of a predisposed disposition, a predisposition to alcohol abuse if they are to drink during their lifetime. Treating addiction, as you know, is notoriously difficult, and there are three general approaches to treating it from a medical standpoint. So on this slide are the three medical approaches. Agonist treatments basically replace the drug with something else that's safer and less problematic, where the individual is less likely to overdose because it doesn't have such swift effects, or it's regulated and it's legal, so the individual is just not going to get arrested. So methadone treatment is an example of an agonist treatment to treat heroin addiction. An antagonist treatment blocks the effects of the drug so that when you take it, you don't experience as much of the effects. Now you have to be careful because sometimes you might block the pleasurable effects or the therapeutic effects, but not block the toxic effects, and so individuals can actually continue to ingest the substance and not, you might not get drunk, but you'll pass out, even though you don't feel drunk. So those you have to be a little bit careful with. And then another strategy is to interfere with the dopamine reward system. There's some drugs to interfere with it in general, because all drugs of abuse will stimulate the dopamine reward system. And as the last slide suggests, some type of medical treatment in combination with a behavioral talking therapy seems to be the most effective way to treat addiction. But addiction, because it's so rewarding, is notoriously difficult to treat.